Good afternoon, everyone. Happy Wednesday. Thank you for tuning in. Good to see you guys and good to be with everybody at home. We're going to be here again Friday at 1 o'clock and then again Monday at 1 o'clock. I would strongly encourage you to tune in if you can. We'll have a lot of announcements today, Friday, Monday, in anticipation of phase 3. Also, you're seeing a lot of changes in the virus around the country. I'm going to address that today, and I'll continue to address that. We're in a good place in Rhode Island as it relates to the virus. But as a country, this is a picture that's changing and evolving every day. So I'm asking you to stay informed. I'd like you to tune in here at 1 o'clock if you can. If you can catch it later, that's fine. Whatever way, I'd ask you to please stay informed. It's the best way to keep yourself safe and to keep Rhode Island in the strong position that we're in. If you can't tune in, I know lots of people are going back to work, which is great. The kids are going back to camp, which is great. I would encourage you to sign up for daily emails. You can go to governor.ri.gov. So our website, governor.ri.gov. Sign up for the daily emails. I know you might not have time to tune in the middle of the day, but we'll send you an email every day. It takes a minute to read, and it's a quick, easy way to stay informed. And on Saturdays, we'll give you the recap for the week. So I'm asking you, governor.ri.gov, stay informed. A lot of people have been asking me, how come Rhode Island's doing so well? You know, we're doing a lot better. I think it's because people are informed. People are informed, they're following the rules, they know the rules, so I would ask you to continue to do that. In the weeks ahead, I'm also going to be scaling back the frequency of this press conference. We went to daily, to 3 times a week. You know, we're going to get to a place soon where it'll be probably a day a week. So it's really important that you find a way to stay informed, which is why I'm strongly encourage you to sign up for these emails, governor.ri.gov. Okay, as we always do in our time together at 1 o'clock, we're going to begin with the data, which continues, thankfully, to be a good news story. And I'd ask you, please, to put the data on the screen. As you can see, we continue to trend in the right direction. We have another 73 cases to report today. And very sadly, yet again, another 6 deaths. So we watch this every day. We watch it every day, the data for the state, particular communities, areas we're worried about, and now we are particularly watching it closely as we think about whether we're ready to enter phase 3. But again, the data that you see there should make you feel confident that in Rhode Island, we're dealing very well with the virus. And I'm encouraged. Now, today I want to have a really serious conversation with the people of Rhode Island, because not every state is in the situation that we're in. And if we get complacent, we're going to be back in a mess. We're going to be right back where we were when we started this. And I do see signs that we're all getting complacent. People refusing to wear a mask, businesses openly violating the rules. Not many. The vast majority are doing exactly what's required. Crowds on the beach when we ask you to disperse, being impatient or rude. I want to be crystal clear about this. This is about science. This isn't about politics. This isn't about what you might want to do. This isn't about what you think might be best to do or most convenient to do. This is just about the facts. Rhode Island right now is in a very good place around controlling this virus. And because of that, people are going back to work. We're going to open school in the fall. Our kids get to go to camp. We get to go to the beach. That is all good. As sure as I'm standing here, if we start to break the rules, we will have to unwind that progress and close off some of our economy, some of our recreation, and some of what we love doing. And there's no reason that that should happen. No reason for it. We should never again have to do that. If We wear our masks, wash our hands, get tested, stay home when we're sick, and follow the rules. Now, you might say, you might not agree with that. So let me just tell you about some of the statistics of what's happening around the country and how quickly our fortunes could change if we start to break the rules. Right now, 33 states now have a rolling average of new cases that are higher than last week. That is a bad trend. That means they're headed in the wrong direction. Now, if you don't believe in the case counts, because different states test at different levels, then let's look at the hospitalizations, which you cannot argue with because that is a fact. People in the hospital because they have the virus. Right now, 7 states are reporting new all-time highs of hospitalizations. All-time highs, that means higher than 2 months ago. Arizona, Arkansas, California, North Carolina, South Carolina, Tennessee, and Texas. Arizona had to again cancel elective surgeries and non-critical procedures last week to make room in the hospitals for the extra surge in COVID patients. In 2 weeks, Texas saw a doubling in its hospitalizations. They went from, in a just about a 2-week period, they went from 1,800 hospitalizations to over 3,000, 3,200. That started on June 5th. Leading into June 5th, the week right before June 5th, Texas looked like it was in a plateau. Plateau in the hospitalizations, things look good. Now the governor in Texas is back out there asking people to stay at home. Home is the safest place to be. In 3 weeks, Arizona saw a doubling of the number of people in its hospitals, from about 1,100 people in the hospital to over 2,200 people in the hospital. Same thing, before that, plateaus in Arizona. So why am I saying this? This can change quickly. These states were in a plateau, and within a matter of weeks, they're seeing their hospitals filled with COVID patients. I don't want that to be us. I don't want to be back up here at this podium telling you the safest place to be is in your home. And there's no reason we should have to do that if we follow the rules. But if we get complacent, if we think we know better, if we want to deny the facts, if we want to try to outrun the virus, which isn't possible, then that's where we're going to be. And I think that would be horrible because there's people's livelihoods and jobs that are on the line. Also, the vast majority of Rhode Islanders have done exactly the right thing, and they should be rewarded for their compliance and not punished because of the minority that refuses to own their shared responsibility to the people of Rhode Island and do the right thing so we can all get through this. Now, many of you may ask, why is this happening in these other states? And I have been honest with you from the minute this started, so I'll be honest with you now. We're not sure. We don't really know. No one really knows. But here's what I do know. I will tell you the facts. 11 out of 15 states, including our own state, where mask wearing is mandated, have seen continued decline in cases. That's just a fact. I'm just telling you the facts. States that have a mandate around mask wearing and higher compliance of mask wearing are doing better and continue to see decline in cases, including in our own state. We also know, because we look at this every day, there's a correlation between the amount of testing, the availability of testing, and the amount of contact tracing and how the virus is progressing. So here in Rhode Island, we have a very aggressive testing approach, the most aggressive in America, and we're going to keep it that way. In fact, we're going to double down and do more testing. and a very disciplined contact tracing effort. The other day I was asked, how do you know the contact tracing is working? Well, I would say the proof is in the pudding. We haven't had a surge. We haven't had an outbreak that we can't control. And I would just ask everyone out there again, if you haven't downloaded the Crush COVID RI app, now's a good time to do it. There's 50,000 of us who have done it, and I'm asking everyone to do it. We don't want to wind up in a mess again. If you've been getting a little lax or lazy with your contact tracing notebook, I'm asking you to buckle down, and myself included, my family included, take a minute every night to write down who you were with. Because if you get sick, we need to see that notebook, and we need to immediately contact everyone you've been in close contact with in the week before. That is the way to fight this virus. Right now we have a winning formula in Rhode Island, and I'm asking you, the people of Rhode Island, to come together and stick with the formula so we can continue to open our economy and do so safely. And I will tell you, many other states are beginning to halt their economic reopening. Governors who had said we're moving forward a phase are saying, hold on a minute. I'm not there with Rhode Island because we continue to see good numbers, but it is really eye-opening to look at how quickly this picture can change. So I think we need to approach this virus with a sense of humility and recognize that it's here, and if we need to follow the rules so it doesn't overtake us, which could happen in a week or 2 or 3. So I'm putting that out there, and I'm asking Rhode Island to continue, even though it's summer, even though we're outside, even though our cases are reduced, even though we're getting back to normal, it is more important than ever to follow these rules. Okay, with that, I would, having said all of that, we're still moving forward towards phase 3. I'd like to be back up here on Monday with, an official announcement about phase 3. And so I'm trying to give a sense of what phase 3 will look like, and I'd like to go through a few topics now. I promised I would be back this week with an update around sports. Obviously, sports I think athletics are an important part of our life all the time. Good for our mental health, good for agility, teamwork, being with people, but especially so in summer. I know a lot of kids sleep in their Little League uniform the night before the first game, and it's a big part of what summer is. And so it's important to me, as your governor, as a mother, as someone who's played sports my whole life, to do everything I can to get kids back out safely. So to that end, I'm announcing the following updates for both youth and adult sports for phase 3. In phase 3, for youth and adult sports, we are going to be allowing no contact and low contact sports games to be played between stable groups with no limit on overall group size. So that's huge. That's great. Until now, we've said only scrimmages or technical, drills and such. But once we get into phase 3, you'll be able to play in stable groups against teams with no limit on the overall group size. What does a stable group mean? A stable group means you have the same players and coaches together over the course of the summer. Same group of players and coaches together over the course of the summer. Why does that matter? That matters a lot. Because if somebody gets sick, we want to contain it to that stable group. No contact and low contact sports is baseball, softball, tennis, golf. Games can be played once we go into phase 3 between teams within Rhode Island as well as outside of Rhode Island, provided that there is no stay-at-home order or other travel restrictions in the state that the other team comes from. In phase 3, we're also going to be allowing spectators at these games, However, we suggest that there's no more than 2 spectators per player, just an effort to keep the crowds down, and spectators are required to wear masks. We're encouraging players to wear masks when practical. Having said that, I recognize that that's often not practical, and so we're asking players to keep a 6-foot distance from one another, use common sense, avoid contact, do not go play if you are sick at all, and just, keep a distance between yourself and your fellow players and stay in that stable group. In phase 3, we are still discouraging close contact sports. So basketball, football, soccer, where you're in close contact. In those instances, youth or people should stick to practices, drills, scrimmages. You can do your football drills and such, but we don't want you playing games, close contact. I'm sure you're going to have more questions. On Monday, the details for youth and adult sports guidance for phase 3 will be posted at reopeningri.com. I will say that as we open phase 3, we're generally moving toward the place of giving you guidelines, recommendations, tools for how to comply. But I'm asking every parent of a child who plays sports, every coach, every athletic director who's involved in summer sports, I'm asking you to be responsible, be creative, and use your very best judgment so that we all stay safe. Last thing I'll say is, everything I just said pertains only to phase 3, which is summer, probably the month of July and maybe some of August. It does not pertain to 2021 school year for interscholastic sports. We'll be back out later in the summer with the new rules around how students can play once school starts up again. Anyway, I'm excited about that, and I know it's going to be this is a happy day for parents and kids who want to play summer sports. So once we enter phase 3, you can actually be playing games again, and it'll be more like regular summer sports. I also promised this week I would be back with an update on our beaches. Last weekend we had a very busy beach weekend. The weather was gorgeous. We did have it wasn't ideal. We have been limiting parking to 50% of capacity, and so as a result, last weekend we did find that we had to close the beaches early in the day, and folks waited in line. So on a hot day, that's no fun, and we want to do better. So starting this weekend, we're going to be easing off of the parking restrictions at the beaches. We'll be increasing the parking to 75% of capacity, which is going to immediately add over 2,000 additional parking spaces, which is substantial. I also want to encourage visitors to buy beach passes online. We're going to make a bigger effort to have express lines. So if you have your beach pass, you go straight through. It'll also cut down on person-to-person interactions. You can do that by going online, beachparkingri.com. Now, I want to be very clear about this. As of this weekend, we are no longer selling seasons passes at the beaches. As of this weekend, we are not selling seasons passes at the beaches. So if you want a season pass, which I hope you do, you can go to beachparkingri.com. That way there, we cut down on the lines, the amount of time it takes in line, person-to-person interaction, and we hope that will get you in and out more quickly. Okay, another bit of news on this front. By this weekend, we are also expecting to launch a new tool so you can check to see whether beach parking lots are full online before you show up and drive to the beach. I know a lot of folks drove to the beach only to find out they had to wait an hour or two before they could get in. So we're hoping that starting this Saturday, you'll be able to go to riparks.com/beach pass, and you can check on parking lot status of a particular beach at a particular time. So we're going to be piloting that Bear with us if there are some glitches this weekend, but I think that's going to help a lot. So you can go to riparks.com/beach pass and check out if there's a line at that beach. Now, this is all great because we'll have a better beach experience, but I want to remind you, no congregating in large crowds at the beaches. Please bring your mask. So if you have to go to the restroom or you want to go to the concession stand to buy something, or you run into people you know, I'd ask you to please wear your mask when you're next to people for more than 10 minutes. And if you have to go to the restroom or use the facilities or buy food at the pavilion. This is really, I'm putting my faith in the people of Rhode Island. We're opening the beaches more, we're making it a little easier for you, and we're counting on you to follow the rules. But I will say, if in the next 2 or 3 weekends, we see no mask wearing at the pavilion, large groups of people bunching up, then I will, in a minute, go back to where we were. 50% capacity or less at the beaches. So let's get this right, let's have fun, and I hope you have a better experience at the beach than last weekend. I also want to talk about testing. So a few times I have been asked about the National Guard and how we're going to wind them down in our operation of COVID, and also how we're going to move our system of COVID response to a more stable place. Because the truth of the matter is, we're going to be living like this until there is a widely available vaccine, which could easily be a year or more. So a year from now, we're still going to be doing testing, still going to be doing contact tracing. And obviously the National Guard, I won't be relying on them as much as we are now. We'll be able to be out of a state of emergency. And so I'm trying to develop our systems to be in a place where we can be in a steady state. And today I want to talk about one step we're taking around testing to put testing into the community permanently and also begin the orderly process of weaning ourselves from the Rhode Island National Guard, who have been fantastic. As I said at the beginning, we are the only state in the country that has tested the equivalent of 20% of our population, and we are going to ramp up our testing. Testing is the key to figure out who's sick, isolate them. At the same time, we have to be integrated into the community. So with that said, this Saturday, June 27th, is going to be the last day of testing at the Twin River site in Lincoln, operated in partnership with CVS. We've been planning for this for a while. They're only now testing a few hundred people there a day. We've been slowly declining. We were at 1,000 a day, now we're at a couple hundred a day. That was always meant to be temporary. And so this Saturday, June 27th, will be the last day of testing at Twin River. I will say, there were some very dark days a few months ago when I didn't know how I was going to do this or how I was going to meet the needs of Rhode Islanders for testing. And CVS Health stepped up. I will forever be grateful to our local company, CVS, for stepping up when we needed them. We continue to partner with them, but between CVS and the National Guard, we set that up over a weekend, literally, to test 1,000 people a day rapidly. And it's been amazing, and I want to say thank you. Having said that, it was always meant to be temporary. They were tense. We had to close it down when it rained. It's been staffed fully by the Guard, so it's time to unwind it. And as you know, we're in a different place now. We are fully prepared for this. I want to assure everybody we've been preparing for it. Our testing demand runs well below our capacity at this point as a state. Even with the expansion of our asymptomatic testing program. So I don't want you to get nervous when I say we're closing Twin River. We could still test more people. We could close today and still have the capacity to test more people than are showing up to be tested. particularly, we are moving in the direction, as Dr. Alexander Scott has said many times, we're moving in the direction of putting the testing right in the community, integrated into our public health system, integrated into our pharmacy system, integrated into our network of primary care providers, hospitals, and community health clinics. So we want it to be easier in your neighborhood. We are still partnering with CVS. You can still go to cvs.com and figure out where there's a close CVS testing site near you. CVS currently has 10 drive-through testing sites, which I've previously announced, which already more than offset the volume that's being done now at Twin River. So this is a change, and I want to just let everybody know, if you feel sick, you should call your doctor. Your doctor can get you to a test. If for whatever reason you can't or don't want to call your doctor, cvs.com, they'll ask you to put in your zip code, and you can go to the closest CVS near you and be tested. It's a drive-through program. I do want to say this, and this is important. The tests that we were doing at Twin River were the rapid tests. You would be swabbed and you'd know your results in 10 or 15 minutes. They were excellent, but as we know, a little bit less accurate than the tests that take a few days for you to get your results. If you go to a CVS drive-through, it will be the kind of a test which takes a few days for you to get your result. So I just want you to be aware of that and not surprised. Having said that, if you show up at a CVS drive-through because you feel sick, you need to be staying at home anyway until you get your results, which is another point I want to make. I want to say this again. If you are sick, you must stay home. If you feel sick, you have a fever, you have a headache, you have any kind of symptoms at all, you call your doctor, you go to a CVS site, you get swabbed, you have to stay home until you get your test results. As the doctor has explained, and as I have learned, people who are sick are fantastic spreaders of this disease. So it's vital that you stay home. Now, many of you are saying, yes, but Governor, if I stay home, I don't get paid. So I'm going to get tested and I'm going to go to work. So I want to remind employers that you must let your employees stay home if they are sick. In fact, you need to be screening your employees every day to make sure nobody is allowed to work who is sick. And these employees should be paid sick time. The federal government is guaranteeing 10 days of paid sick leave to workers who are employed in small businesses whose businesses otherwise don't provide sick time. That's in addition to the 5 days required by Rhode Island state law. Every Rhode Islander is granted 10 paid sick days. 5 from the state, 10 from the federal government. If you are sick, I need you to stay home. And you will be paid to stay home, sick. Also, unemployment insurance, if you have coronavirus and can't work because of it, you may be eligible for unemployment insurance. And I would encourage you to reach out to the Department of Labor and Training to see if you qualify. And finally, Rhode Island has temporary disability insurance, which you may also be eligible for if you have symptoms, which prevent you from working. You're too sick to work, or they prevent you from working, and you can also get in touch with Department of Labor and Training for that. So I do want to be very clear about this. If you are sick, you need to stay home. If you go get a test, you feel sick, you have to stay home until you know if you're negative. I also want to say we are still going to be using our Abbott machines. We have more than a dozen Abbott machines, And what we're going to use those for is rapid testing for nursing homes, outbreaks, places of communal living, when we have to get into a community like Central Falls, Pawtucket, Providence, homeless shelter. We're going to be using those rapid machines for a rapid response. Statewide, we have the capacity to run more than 5,000 tests a day, but on most days, we're running about just under 4,000. So if you take one thing away from this press conference, we need to test more people. We have capacity to test more. And I'd like you to consider getting tested. If you feel sick, you should get tested. Call your doctor and get tested. If you work in a close and contact business and you feel fine, I still am asking you to get tested. And we're working every day to make it a little easier and a little more comfortable. Different swabs for the nose to make it more comfortable. If you're a hairdresser, a waiter, a waitress, a member of the clergy, if you work at a gym, if you're a child care worker, if you're a bus driver, if you've been to a protest, if you've been to an event and you found yourself surrounded by a lot of people for more than 10 minutes and you just want to play it safe, go get tested. Please, we need more information to know who's sick, which communities have a high density of the virus. And so our greatest strength right now is testing and pinpointing and contact tracing. So we need to do more testing. And if you're hearing me say this and you're a waiter or a hairdresser and you're a little bit afraid, I'd ask you, please consider it. Do it as like your civic duty to Rhode Island. We all have to do our part, and this will help us help you and keep Rhode Island safer. Finally, I want to give a quick shout out to my commerce team and the Rhode Island Tech Collective for helping us connect with employers to provide critical information about testing. In May, as we began to build our strategy for reopening the economy and getting our employees back to work, our testing team reached out to the Tech Collective to try to figure out a way to quickly get in touch with businesses to understand the business's plans for testing, reopening, and response. And in partnership with the governor's office and Commerce, the Tech Collective created the COVID Business Engagement Team, which is an amazing thing. It's a volunteer task force. These people, as part of the Tech Collective, have been volunteering to reach out to local business owners to provide businesses with testing information, and support. I want to thank you. Thank you to the Tech Collective for doing that. You've been instrumental in providing technical assistance for these companies so they can develop their outbreak response plans and their testing plans. And I want to encourage businesses to, if you haven't talked to the Tech Collective, if you haven't talked to Commerce about your outbreak plan and your testing plan, we need you to do that. If you're a restaurant and you don't have an outbreak plan, that's a problem. If you're any business really and you don't have an outbreak plan, you need to have one. We need to hear from you immediately if you have 2 or more employees who get sick. And so we've created a COVID business engagement team, and we'd like to see you use it. You can call us at 521-7805 or visit thetechcollective.org and ask about the business engagement team. All this will be on reopeningri.com. But if you're a small business out there, you have no idea how to develop an outbreak plan, and that's very likely, call us, we'll help you, and that way there, if something happens, we'll be ready to respond. So with that, I'm going to turn it over to Dr. Alexander Scott, and then we'll both answer questions.
Thank you, Governor. Good afternoon, everyone. Thank you for being with us today. We're going to continue to emphasize the importance of those key activities people can do. We are seeing that it works. Wearing a cloth face covering, maintaining the 6 feet of distance, that's what works to help control the spread of COVID. I also want to thank everyone at the Rhode Island National Guard, everyone in the testing work stream of the state's COVID-19 response, and everyone at CVS who helped make the testing site at Twin River such a success. We were able to identify more than 4,000 positive cases at the Twin River site, which meant that we were able to get these people into isolation very quickly and able to get to their contacts and get them quarantining very quickly. Also, key elements to us controlling COVID. Having said that, the shift we are making is a good one. Over the last several weeks, we've worked very hard to locate testing sites in the community. We want testing to be as accessible as possible to people in the hardest hit communities, and we want testing to be just as accessible for people with transportation challenges as well. As a reminder, if you have symptoms, but you either have not been tested yet or are waiting for your results, first, get tested. And second, even if you received a negative result, you should still isolate at home as though you have had COVID-19 until your symptoms are completely resolved. That's critical, particularly as we're coming up into flu season. We want everyone to understand if you have any symptoms, once you've gotten tested, you should be staying home to recover completely. In terms of our data for today, we're continuing to see relatively low numbers at this point. We have 73 new cases to report today. There are 104 people currently hospitalized. Of these 104 people, 20 people are in the intensive care unit in hospitals across the state, and 16 people are on a ventilator in one of those ICUs. Sadly, we have 6 new COVID-19 associated fatalities to report for today. One of these people was in their 70s. One of them was in their 80s. Another one was in their 80s. One was in their 90s, and 2 were older than 100 years old. Our prayers continue to be with the families of these treasured Rhode Islanders who have passed away. I also want to update on our thinking for nursing homes and assisted living facilities. We have shared recently that during phase 2, the challenging decision to have no visitation to nursing homes and assisted living facilities must continue. We have also been using this time during phase 2 to prepare for the approach that we want to explore for phase 3. The approach we're taking at these facilities is similar to what's happening throughout the state in that we are taking a measured, gradual approach. We're not going from no interaction in nursing homes to just full visitation overnight. That would be dangerous. And our plan is to move safely, steadily, and incrementally. So I just want to take a few minutes to share what our approach has been as we prepare during phase 2. Last week, we sent guidance to nursing homes and assisted living facilities, allowing them to restart communal dining and activities for residents within the nursing home facility. To be clear, that is just for the residents in the facilities. The assisted living facilities started resuming those communal activities on Mondays, and nursing homes started today. It's a way to start very limited and to assess what slightly increased mobility within the facility would look like. What we said to facilities is that we want you to be able to do this safely and effectively for 14 days first. In the meantime, we're continuing to collect and review plans from facilities on an ongoing basis for how they would allow visitation in a way that is safe for everyone. We've received roughly 40 plans from facilities thus far, and we'll continue to engage with them to make sure that each facility has the bare minimum approach and understanding to how to address visitation in a steady, phased, slow start. What we are working on with facilities is to slowly gain the experience with a slight increase in mobility while making sure that we are keeping patients and staff safe. We recognize that this has been an enormously trying time for residents and their families. And we want to make sure that you can hear what our general vision is when it comes to our approach to visitation, making sure that it's slow and steady and safe. As we've been saying, whenever we have talked about how we will go forward in the future, everything also continues to depend on data and disease trends, which we will continue to monitor extremely closely. I'll finish with making two other points when it comes to visitations and expectations. The health and well-being of residents and staff are absolute priorities for the administrators of facilities in Rhode Island, for the staff of those facilities, and for the families of the residents. We understand that we all have the same goal. That being said, there may be an instance in the future in which an individual facility, in consultation with the Rhode Island Department of Health, makes decisions about visitation that are a little more restrictive based on the data that they have. All facilities are different, and what I've described today is only a general approach. We will continue to work closely with facilities, the staff, the administrators, and the families to support them so that you can be ensured that this process will continue to be safe for your family members. The second point that I want to make is that when visiting does happen again, it is going to be different. You're going to be wearing your mask. You're going to be practicing social distancing, staying 6 feet apart. There may be visitation outside because the transmission of the virus is less when it's outdoors. And you're probably going to be making appointments and doing other things that you may not have been accustomed to previously. So as we're all preparing for this decision, when that time is right, we want to make sure that you also have the tools that you need, have your cloth face covering, and have the preparation for distancing. So we ask you to please be patient with administrators and staff at facilities. The aim of everything they are doing and we are doing is keeping your loved ones safe. With that, we will get started with questions, and I can pass it back to the governor.
You say there's a likelihood that when this phase 3 begins, I don't know that we have a date for that yet, but when that begins, some nursing homes or assisted living facilities may allow visitation, others may not. Is that what you're saying?
We are going to be working with each facility to on the timing. We want to make sure that they're able to have the experience and the safety practices in place that are needed. We will get to a point at some point in phase 3 when all facilities have the visitation, but we want to take that process in a phased, steady, safe approach.
Governor, New York, New Jersey, Connecticut joined together to do a mandatory quarantine for travelers from states with high spread rate. Where are you on that? Are you considering that as well? And do you think Governor Cuomo is being hypocritical given that he threatened to sue you 3 months ago for singling out New Yorkers?
I was teasing people yesterday. I said, I'm glad he's come around to my way of thinking on this. But the truth is, I think it's a good idea. And it is one that I am considering. And I think he's being smart about it. The fact is, those states have done a very good job reducing the rate of spread. And I just explained, Arizona, Arkansas, California, et cetera, are struggling. I didn't join with them today because I'm still looking at it. I'm likely to do something very similar, if not the same. I haven't fully figured out how we're going to operationalize that and enforce that. And furthermore, I might do something even a little more stringent, figuring out exactly which counties people are coming from. So the short answer is, I think it's a good idea. I'm looking at it. We're very likely to do something very similar. I just needed a couple more days to figure out exactly what.
And if I can follow up, what would you say to the people who have already now made plans to visit Rhode Island, rented a house,
Exactly.
going to Newport, who are coming from Florida or the Carolinas, who have family up here and have now made plans and thought they were in the clear and now may not be?
That's exactly why I didn't join that announcement today, because there are a lot of what ifs and how's this going to play out on the ground? It precisely what you just said, Brian, is one of the things we thought about. So I didn't want to launch it before I was ready to execute it on the ground and have good answers to all these what if questions. So that we're going to take a couple more days and look at it and make our decision. Here's the good news. Because we're testing a lot, as I just explained, we have capacity to test more than we've been testing. You could imagine that we would work with, say, realtors. You just referenced rental. And it's possible that we could require those folks to be tested. We're fortunate enough that we could figure out who people are, get them tested. If they're positive, obviously be in isolation. If they're not, take a different approach. So there's a lot of what ifs. How do you manage this at the airport? How do you actually find these folks? How are you going to enforce it? So I'm just not quite ready to roll it out.
Well, Governor, it's been reported this morning that the Trump administration is actually curtailing testing in parts of the country. The Houston Chronicle, Business Insider said that FEMA is going to scale back testing in places like Texas and Arizona. And that seems to me it would interfere with any plans you had to have people tested there. Does that affect Rhode Island? And do we have any FEMA-funded testing in Rhode Island or nearby areas that will be?
No, so let me be clear about that. I think that is wrong-headed and reckless, and I do not support it. And that's not how we're going to operate in Rhode Island. We've worked very hard for the past 4 months to shore up our own supply chain, our own set of vendors, our own testing partners, including CVS, so that we can continue to do what we're doing. Now, to be clear, that's all being funded by federal funds. You know, a big chunk of the $1.25 billion that we received from the federal government and COVID relief fund is for testing, but we are not overly reliant on FEMA at this point in time, because I wanted to make sure I could take care of the people of Rhode Island, regardless of what politics might be happening in the White House.
Governor, is there an exemption for police officers for wearing masks? I've been hearing reports that people have been encountering police officers without masks. Just last night, I was at the Columbus statue in Elmwood, and I saw a lot of police officers congregated without masks on. Same in Newport, where they were counting the number of people to get onto Bailey's East Beach. Just wondering if that's a choice that's being made and what your advice is to law enforcement about masking and other protocols.
Wear your mask. I mean, look, if you have to be practical, if they're in an emergency situation, if it, like everyone else, you have to use some sense of judgment. So there may be instances, of course, where in their professional judgment, they can't find it, they can't, that we understand. There are practical limitations, but there's really no excuse in an example like you just said, if you're there, if you're gonna be in a relatively calm environment for a while, you should absolutely wear your mask. I have heard actually from a number of folks who've been, stopped by the police or parking violation or whatever, and the local police officer approaches the car without a mask. That really isn't acceptable. It's similar to the principle of if you're in your car going to a drive-through, if you're going to drive through McDonald's or Dunkin' Donuts and you're alone in your car, put your mask on for the second that it takes to get your food out of consideration for the person delivering the food. So the other day, Brian asked me about groups where we're seeing lack of compliance. This has come up more than once, and the answer is they need to be wearing their mask whenever practical.
Governor, you went to LaSalle Academy.
I did.
Monday night, right down the street from there, cemetery at Providence College. Gravestones, swastikas, anti-Catholic slogans, burned flags. Last night, 100 police were outside that Columbus statue. Can you address this notion to some people that desiccating graves or ripping down a statue is an acceptable form of protest?
It is not an acceptable form of protest, ever. Vandalism, crime, violence are not forms of protest. They are crimes. And they should be, folks who do that should face the consequences. Having said that, yeah, it's horrible. It's hard. I wasn't aware of what you just said. I mean, it turns your stomach that people are putting swastikas on grave sites. So no, I'm crystal clear on that. I'm unconflicted on that point. If you want to have a protest against a Columbus statue, I respect that. If you want to vandalize it, that's not allowed.
Can you just confirm tonight you're going to be, from what we understand, on with Jim Cramer and CNBC? I'm just curious the topic.
Testing. A lot of other states are wondering, I mean, as you know, when you agree to an interview, you're never really sure what will be asked, but I was asked to go to talk about Rhode Island's testing.
On testing, without the rapid test, how are we going to identify asymptomatic populations in a timely manner that they can actually be isolated and kept out of the workforce effectively?
I'm going to let the doctor answer that because it's no different than we're doing it now.
Yes, people who are tested now are people that we recommend and require to monitor yourself for symptoms. And certainly if symptoms exist, to be able to stay home until those symptoms resolve. We're working to make sure that the turnaround time for testing is as accessible as it can be for the labs that are used currently for testing. The current Abbott ID Now type of test is no longer as recommended for people who do not have symptoms. So the question that you asked and our approach to it is being taken across the country. We are all going to do the best we can to ensure that people without symptoms who get tested get their results as soon as possible, while maintaining the understanding that they should continually monitor themselves for symptoms, and if they develop symptoms, absolutely stay home until those symptoms resolve.
Is there a target time frame for getting those results that you're looking for these new tests, or for the tests that you're focused on and ramp up testing?
Yeah, these are the majority of the types of tests that we have done, and the target time frame is to stick with the standard that our Rhode State Health Laboratories follows. Within 2 to 3 days, that result has returned. So we are working to make sure that all of the labs across the state, reference labs and others, move towards that standard.
And one more on testing. Are we seeing any decline in the age, the average age of our positive tested population like the other states are seeing?
I can get you the definitive numbers that we have and determine the trends. We continue to see older populations at this point who are impacted, and that's also correlated with the fact that we as a state have an older population in general. But we will continue to monitor that and see if the trend continues to play out, that younger people are impacted. It is why we are very persistent about saying everyone needs to, even though you're feeling well, wear your mask and physically distance regardless of your age.
Governor, back to the youth sports, on the close contact sports that you said you still don't want to see games for now, like football, basketball, soccer. Is there a thought as to when that could resume, or would you, like in August or a phase 4, or would you say probably not?
That's hard to say. It's a risk. I mean, it's a difficult call. I could easily say, I think probably not. Having said that, I reserve the right to change my mind. You know, close and contact sports, that's really the most dangerous kind of thing you can do, because you can't really wear a mask if you're, breathing heavy, exercising, and you're near people, and so that's probably going to be like one of the last things to come back.
And seeing as though the football and soccer are both fall sports For
Right.
school, when again do you think you might pinpoint when that guidance might come for the
Well, the
school sports?
school's hopefully going to be August 31st, so mid-August, if not early August, we'll be out with interscholastic sports advice generally. So, or I guess early August.
Governor, I'm just wondering about the beaches. We heard from people over the weekend who said there was no space to social distance and they felt like the beaches were overcrowded. So I'm just wondering, and you said it on Monday too, there were large groups congregating who sort of refused to break up their groups. Why decide to expand capacity when it seemed like maybe there were too many people there already over the weekend?
Excellent question. So people were getting onto the beach. They were walking onto the beach, parking in neighborhoods. We had a ton of complaints in Narragansett, Westerly. People were parking often illegally on the neighborhood streets to walk to the beach, carpooling. So I don't actually think that increasing the parking capacity is necessarily going to increase the number of people on the beaches. I think it's going to reduce people waiting in line and parking down the street illegally and walking. So that's really this change, honestly, is to just make it a little easier for Rhode Island. I mean, people are going through a lot right now. It's a hassle to wait in line. Anyway, so that's the theory on that. But as I said, clearly you could maybe tell the way I presented it, I'm a little nervous about this. So we're going to watch it every weekend. And if we start to see large crowds, we're going to have to go back to some form of restriction.
Governor,
Hey, you're not done. Go ahead.
On the Abbott ID Now test, the testing validation task force recommended that the state phase the test out completely. Obviously, you're closing that site, but you said you're still going to use that test for places like nursing homes or outbreaks. Those seem like the most important places to have accurate results. So why use a test that 1 out of 5 people get a false negative?
Yeah, so the testing and validation task force did a very thorough analysis that we are grateful for. Also take into account the data that was available nationally. The clear recommendation is to move away from using it on people who do not have symptoms, and then also limit it for people who are in high risk settings as a healthcare worker, so a healthcare worker in a nursing home. We have moved away from using the Abbott ID Now rapid tests in those specific situations. There is value supported by the fact that we have identified 4,000 people who have been positive to continue using it in certain situations where people have symptoms, where they may not be a high-risk professional working in a delicate setting, but would benefit from having that rapid turnaround time. So we're supporting hospitals to be able to have the Abbott ID Now instrument, and certain mostly healthcare related settings to be able to use the machine, but then also have the healthcare provider support so that if someone tests negative, but clinically and epidemiologically has symptoms of concern, we can do something different. So that's also part of this process as well.
Doctor, while you're there, is there any update on the backlog from some of the private labs on the respiratory clinic test, particularly for folks who were at one of the protests, asymptomatic, and then went and had that test? There's some people who have now, at least they're saying that it's been well over a week since they were tested.
Yeah, that's something that we are directly addressing and having conversations even today on how we are handling it with the laboratory companies that we have told this is unacceptable to do. As I mentioned earlier, the standard that we want labs to really follow. In terms of those who have been tested, we have over 3,000 tests that have been scheduled of people who are asymptomatic. And we have results for over 1,500 of them as well, and we're continuing to get more as we go. I wanted to be able to share that thus far, the percent positivity among that number continues to be much less than 1%. So that's also helpful data to be aware of, and we'll continue to work very diligently with those labs and improving the turnaround time.
For the governor, you had I had asked a couple of weeks ago about the effectiveness measurements of distance learning, and you had said that Commissioner Infante Green and others had a team working on evaluating that in some sort of rigorous way. This morning, interestingly, McKinsey, the consulting company, issued a report which very closely mirrored your idea about having a plan A, a plan B, and a plan C, of full distance learning, full in-person learning, and a hybrid model, and how that would affect people. And the quick summary of their estimate was that they felt that, and this is again national, so they're talking about cases where they don't do anything over the summer, which Rhode Island has made an effort to do. But they've said that they're expecting people, students to regress an average of about 7 months of education in these models. And it'll disproportionately affect Hispanic students who lose about 9 months, Black students lose about 10 months because of the disparate availability of school quality, technical access, and so on. And then they also said, which I found very disturbing, that high school dropout rates, which are currently between 4 and 7%, depending on where you are, who you are, may extend by between 2 to 9 percentage points, effectively doubling high school dropout rates. Have we in Rhode Island made any effort to measure that, to estimate that, and to counteract that?
Yeah.
And if so, what?
Yeah, so I haven't seen the report and I will check it out. So thank you for bringing it up. So listen, this is why I'm so focused on getting these kids back to school in person in the fall. We did a great job with distance learning. I would venture to guess Rhode Island is among the best in America in how we did distance learning. And we really worked hard to make sure that nearly all students had access to the internet or a hotspot. You know, that's another issue. And I'm very proud of that. We had 98% of our students who had internet to do their work. Having said that, this is a fact. The longer it went on, the harder it was, right? It's just harder to maintain rigor and the attention of students and teachers when it dragged on. So there's no doubt in my mind that some kids fell behind. And I wouldn't at all be surprised if it were, you know, as you say, you know, poorer kids or kids whose parents can't be home helping them with their studies, et cetera. So that's why it is a top priority of mine to open schools August 31st, get these children in school, nearly all kids in school. That's where they can learn. Also, it's why we're providing summer school. I mean, we've had thousands of kids sign up already for summer school. That is very impressive to me. I don't know if I would have done that, voluntary summer school. So we're pushing it to make sure nobody gets left behind. But am I worried about it? Absolutely. And the commissioner, if she were here, would tell you the same thing. She's very focused on kids who learn differently, the multi-language learners. There's a gap. A lot of these kids start behind and then distance learning put them further behind. So I will look at this study. Obviously we don't yet know the long-term effects of the distance learning. I do think we did it better than most other states. Children here didn't ever miss a day of school. You have to remember, a lot of states just had school out for a month or more. Even Massachusetts, the kids were out a lot longer than our kids. But it's a problem, and we got to get back to school.
Governor, if you had any questions and people were tuning in, we get questions from people who thought you sounded especially stern today. Is it because of what's happening? I'm sorry?
No, go ahead.
Is it because of what's happening in other states, or is it something in Rhode Island that you're aware of that we're perhaps not?
No, I was intentionally especially stern, because I'm going to be very unhappy if we have to shut this economy down again, because there's no reason for it. We have less than 2% test positive now. We have the best testing in America. We are doing great, all things considering. I realize it's a horrible time. I realize there's a lot of people out of work. I realize we've lost many, many lives. Relatively, we're doing well. But I get angry when I see people, like Kim was just saying, routinely violating the rules. Look, we all make mistakes sometimes. We all forget our mask once in a while. We all forget to social distance for a minute. But you have to recommit yourself to doing better. because I know if we don't, we're going to look like these other states. And it could happen in a week or 2 or 3 weeks. So I am stern, I am serious, because there's no reason that has to happen. You see governors, you're gonna see more, governors are gonna start to come out and say, halt the economic reopening, pause the economic reopening. And I never wanna have to do that. And I don't think we should have to if people follow the rules.
Governor, you're a resident of Providence like Mr. Smiley. I'm not sure where Dr. Scott resides, but how excessive, are you hearing the fireworks at night?
Yes.
And are they excessive? Could you touch on that?
Yes, I think they are excessive. If you want my personal opinion, you know, they're noisy. And I'm not the mayor, but I will remind the residents of Providence that they are not legal. So I would say you probably should cut it out.
Are they, or knock it off? Are they late into the night as we're hearing, like 2:30 in the morning?
I don't know. Mr. Smiley stays up later than me. I don't know.
Do your children enjoy hearing them?
No, they do not.
What about the first gentleman?
He does not either.
Would you repeal the sales of fireworks in Rhode Island? They're banned in Massachusetts.
It's an interesting thing to think about. I think we just need to do, right now I'm focused on enforcement, and I've talked to the mayor about it, and we have to get the word out that this is not allowed, this is not legal. This is the first time this has happened. This wasn't happening last year. It seems to be a trend all around the country, and we need to put a lid on it. I want to say one thing quickly to Kim, because you raised a good point. We have to use the technology that's available. And each technology plays its own role as we deal with this crisis. If you're in a situation we are trying to rapidly identify as many positive cases as you can, there's a role for this Avid ID device. So if you have an outbreak at the ACI, if you have an outbreak in a manufacturing operation, whatever, in a community, and you want it to quickly find positives, there's a role for it. And with the Abbott machines at CVS, we found thousands and thousands of positives and quickly and got them into isolation so they didn't spread it. So it is true, as you say, that it's not the best in class, gold standard, most accurate. But if you're in the business of quickly finding positives and putting them in isolation, there's a role in a toolkit. It's a tool in the toolkit that we're going to continue to use.
Governor, you're on the far side of that. But you don't see that the seal on the front of it now has removed the words Providence Plantations.
But I had that done, so I enjoyed it.
I assume you know you did it.
Yeah.
But did you have any comment? Because it's very obvious from all of us.
I think it's a good thing. You know, I think it's high time that it happened. I've talked to too many Black Rhode Islanders who have told me how hurt they feel. It's a slap in the face. It's in their face every time they look at their paycheck, look at my podium, look at the state seal. Why do they have to confront a word that conjures horrible images of slavery? And so the fact that you noticed, you know, people said words do matter, symbols do matter. If we're going to be a state of inclusion and unity, words and symbols matter. And the fact that you noticed, I think is a great thing. And I hope others in Rhode Island also notice. Thank you.
Governor Raimondo, question here. With the tax base in Rhode Island facing historical challenges, what hard asset sales has your administration considered? And I'll use an example of the building we're in right now. It's obviously part of the Rhode Island Convention Center Authority, which continues to hemorrhage cash, $28 million in subsidies, plus operating losses, including to Bloom Shapiro, the accounting firm. So which hard asset sales are you considering if, in fact, the federal government doesn't bail us out?
Yeah, good question. So if we don't get an additional stimulus, which I'm reasonably confident we will get, everything's on the table, including real estate. So I've directed Director Smiley to do a full survey of all of the state's real estate. Like every company in America, we need to ask ourselves, can some people work from home? And if you can work from home, you can sell some of your real estate. So I don't have any particular building in mind. The state has many assets, and we're looking at them all. And candidly, even if we do receive federal stimulus, I might still be interested to do some asset sales, because if we can go to a place where, I don't know, call it 20% of our workforce can work from home, we can sell some buildings and put that money to good use.
Thank you very much.
Bye.